my appropriate PPE. My gloves are on. Is my scene safe?
Yes.
Okay. Mechanism of injury?
Young male complaining of injured right knee during football game.
Okay. And is this my only patient?
Yes.
Okay. So I'm going to immediately call for ALS backup, and we'll consider C-spine. However, we will not hold C-spine at this moment because it's just an injury to the right knee. General impression of the patient: we have a young, healthy-looking, 20-something-year-old male. Is complaining of right knee pain. So we're going to determine level of consciousness. The patient is alert, verbal, able to speak, so definitely conscious. We're going to go ahead and cover the chief complaint. Chief complaint is, again, pain to the right knee. Not sure if it's a broken right knee or what other issue it might be. At this point, we're going to check assess the ABCs, which is airway. So again, since he's speaking, he's verbal, no obstructions in the airway, that's clear. Breathing, he has respirations of
15 respirations per minute.
So 15 respirations per minute. Okay, that's a good rate. So no issues there. So we don't need any additional oxygen therapy, and we have adequate ventilation at this moment. So after that, we'll check circulation. I'm going to go ahead and see if there's any major bleeding.
No bleeding.
No major bleeding. Okay, I'm going to go ahead and check pulse.
70.
So we have a good, normal, strong pulse, regular pulse. And I'm going to go ahead and set skin color. Looks like we're pink, and skin is warm. So that's all good. That checks out. I'm going to go ahead and categorize this patient as a level 2. So this is kind of high priority. We will transport to hospital for additional care. At this point, we're going to go ahead and check the OPQRST, the history taking. So the onset. So when did this happen?
30 minutes ago.
About 30 minutes ago. Okay. And is there anything that makes it better or worse?
Better when keeping the leg straight.
Keeping the leg straight. So we'll go ahead and splint the leg to prevent any further injury. Keep the patient from being as comfortable as possible. And quality is, what type of pain is it? Is it sharp pain? Is it a throbbing pain?
Sharp pain.
So sharp pain. Okay, good. And is the pain, it's in the right knee? Is it going anywhere else? Is it going down to the foot? Is it crawling up the leg or going over to the other leg?
No.
No. Okay. And severity on a scale from 1 to 10, 0 or 1 being the least amount of pain, 10 being the worst pain you've ever felt. What would you say the pain level is?
8.
8. Okay. And time. So how long has this injury been going on for?
30 minutes.
So you've been in pain for about 30 minutes. Okay. QRST. So next, we're going to go ahead and check past medical history. So do you have any allergies?
No.
No allergies. Any medications that you're on that we should know of?
No.
No. Okay. And is there anything that you've done to the past to injure your right knee, anything like that?
No.
Okay, no issues there. And what's your last oral intake like?
A burrito 3 hours ago.
So a burrito 3 hours ago. Okay. And tell me about the events leading up to this injury.
Patient was running during football game and after being tackled has been complaining of pain to the right knee.
Okay, so complaining about pain to the right knee. Again, knee injury, possible broken knee, not too sure yet at this moment. So then we're going to go ahead and do the secondary assessment. We're going to go ahead and check check for jugular vein distension. I'm going to go ahead and take a look.
No jugular vein distension.
No jugular vein distension. Okay, I'm going to go ahead and check with my stethoscope. I'm going to go ahead and check the lungs.
No abnormal lung sounds.
No abnormal lung sounds. Okay. Then I'm going to go ahead and check neurological. I'm going to check the eyes with the light. See there?
Regular pupils.
Regular pupils. Great. Okay. And so after that, I'm going to go ahead and check musculoskeletal.
Possible broken right knee.
So possible broken right knee. All right. Gastrointestinal. So you have any issues defecating, any irregular abnormalities with either defecating or urinary?
No.
Nothing there. Okay. And any reproductive issues?
No.
Maybe we should know about?
No.
No? Okay. And PPP. And so have you ever had anything like this happen before?
No.
No. Okay. And are you having any thoughts of suicide or any anxiety, anything like that?
No.
No. Okay. So that checks out. Next thing, we're going to go ahead and check for vital signs. I'm going to go ahead and check blood pressure. Should I go ahead with my stethoscope?
140/70.
140/70. Okay, I'm going to check pulse.
70.
70. It's a good regular pulse. Okay. And I'm also going to check respiratory for respirations.
15 respirations per minute.
15 respirations per minute. Okay, that's a good rate. After that, I'm going to go ahead and give a field impression of my patient. Looks like I have a young, again, 20-something-year-old male who has an injury to the right knee, possible broken right knee. So we went ahead and we splinted the right knee to prevent any further injury or any issues there. And we're going to go ahead and, again, calling for EMS. So we're going to, since this is a stable patient, we are going to reassess every 15 minutes. The primary assessment, secondary assessment, the vital signs every 15 minutes. And then I'm going to go ahead and give a verbal report to arriving EMS about what I found during my assessment of the patient.